I work with the Iowa Cancer Consortium, and this is the last in our fiscal year 13 capacity building series. We are lucky to have with us Rachel Kennedy, a behavioral scientist with the American Cancer Society. She's going to talk about the Survivorship Center. And at this time, I'm going to turn it over to Rachel. And again, if you have questions for her, please type them up in that chat box, and periodically she'll check those and respond to them. So thank you.
Yeah, good afternoon, everybody. Thanks so much for spending your lunch hour with me. I appreciate your time. And Sarah, you might have to keep me informed of those questions. I might get a little too deep in the presentation and then forget to look over there. So feel free to remind me that questions are coming in. But thanks again for joining me, and I'm excited to share with you guys the work that we're doing with the Survivorship Center. Here's a brief look at what we'll be talking about today. I will be sharing an overview of the Survivorship Center, gaps and recommendations from our year one work, deliverables and resources that we've created, and then lastly we'll talk about next steps. So in September of 2010, the CDC recognized the American Cancer Society's demonstrated success in the provision of information and resources to cancer survivors and their caregivers, combined with the research expertise and strong background in the development of clinical guidelines for early detection of cancer, along with the ability to impact private and public policies, and awarded a 5-year cooperative agreement to develop the National Cancer Survivorship Resource Center, which is shortened to the Survivorship Center. This agreement includes the plan to leverage the existing collaborative relationship with the George Washington Cancer Institute in Washington, D.C. GWCI has demonstrated expertise in the development of a survivorship clinic for childhood cancer survivors and a unique longitudinal approach to patient navigation. Additionally, GWCI's strong presence in clinical care and education of patient navigators and healthcare providers uniquely positioned them to collaborate with the Society to achieve the goals and objectives of the Survivorship Center. So I'm sure you've had a chance to skim through the aims, so I won't read them to you. Survivorship Center accomplishes its aims by improving the quality of life. Oops, I'm not advancing. There we go. By developing and distributing a broad range of cancer survivorship tools and resources for providers, cancer survivors, and caregivers, by developing cancer survivorship clinical practice guidelines for primary care providers, and by educating primary care providers about how to best care for survivors, as well as by promoting healthy behaviors to reduce late and long-term effects of cancer and its treatment through self-management. Survivorship Center is organized using the Socio-Ecological model to address multiple levels to positively impact survivorship outcomes. These levels are the individual level, aimed at addressing the needs of survivors, the healthcare system level to impact providers and the systems in which they work, and then the society policy level to address such issues as reimbursement and research. In order to meet the objectives of our Year 1 activities, the Survivorship Center convened a panel of more than 130 experts representing more than 50 organizations nationwide, under the direction of a core team of staff representing the American Cancer Society, George Washington Cancer Institute, and the Centers for Disease Control, and the leadership of a steering committee composed of national leaders in survivorship clinical care, research, and advocacy. 4 expert panel work groups were formed to identify gaps, develop recommendations to address these gaps, and identify performance indicators by which to measure progress. So the following slides, I'll focus really on the gaps, recommendations, and indicators. The gaps were identified across each level of the socio-ecological model. I know these might be hard to see here, but we're actually going to focus and pull out those gaps in detail in following slides, so don't worry about trying to consume all of this information now. While each work group focused on specific issues of the socio-ecological model, there was tremendous consistency in the strategic recommendations from among the work groups. And these key recommendations include refine and implement the chronic disease self-management model to address the needs of cancer survivors, fill gaps in information and programmatic resources, develop clinical follow-up care guidelines to assist primary care providers in providing care to the growing number of cancer survivors, and to encourage communication between primary care providers and the oncology team, and then to develop policies that enhance the evidence base and support the provision of high-quality, timely care of cancer survivors. Several performance indicators were identified to measure the progress of the Survivorship Center toward achieving its aims. Many of these indicators are challenging to measure since there's no single source to monitor survivor knowledge, perception, and quality of life, and many healthcare systems and payers do not yet measure the provision of survivorship services. An underlying element of the Survivorship Center's work is to identify existing sources of data to measure these indicators and to make recommendations on how surveillance and reporting systems can be enhanced to improve measurement of survivorship outcomes. Although the body of literature on cancer survivorship has grown, there are still gaps regarding information content and delivery. So two of the four work groups that we had from that initial slide that I showed you guys earlier were charged at taking a deeper dive into the types of survivorship information and programs that are available. I'm going to focus focus now on the individual level of the socio-ecological model. The purpose of the information delivery work group was to represent the informational needs of survivors to empower decision-making and communication with healthcare providers. And this diagram is actually a constellation of information sources. Work group members conducted a landscape analysis of current evidence-based information available to cancer survivors and identified performance indicators and outcomes in order to first monitor the development and implementation of information and delivery channels to increase the health literacy of survivors and their caregivers, and then secondly, to ensure that survivors and their caregivers have resources needed to communicate with the healthcare team. Three main gaps were identified by this work group. First was the availability of cancer survivorship information, and more specifically, the overall lack of post-treatment survivorship information. We all know that a lot of times, a lot of resources that are available are just inundated with information for cancer survivors who are in treatment. And really, we noticed that in this gap analysis. Secondly was the need for a tool to assist survivors in seeking information. And then lastly, there were gaps in communication between providers and survivors. So to fill the gap in the availability of post-treatment survivorship information, we have compiled a survivorship information resource inventory, which contains over 350 resources. The majority of these resources were available through multimedia outlets, namely the internet, call centers, video, and podcasts, and we are currently working on a manuscript for publication that details this gap analysis. We've tried to wrap our heads around being able to put together this inventory as kind of like an online tool to use, but it's not feasible in the format that it's in. It's kind of cumbersome in the way that I spent months putting this resource inventory together, and it's quite cumbersome and not user-friendly. So we're going to try to really detail the process that we went through, our methodology, and kind of highlight the more high-level resources that we found and then the gaps that we found in that manuscript. And then perhaps one of the most important gap fillers that addresses the lack and availability of survivorship information is the development of the Survivorship Center's webpage on cancer.org. And it's at the bottom of this slide, cancer.org Survivorship Center. I don't want to tempt you guys. I know some of you might be sitting right in front of your computer, so you might want to look at that later. But the site actually provides updates on our activities, access to newly developed materials and reports, and it's a platform to link professionals and survivors to tools and resources. The The work group also developed the Life After Treatment Guide, which is a short booklet for post-treatment survivors. In addition to offering tips for evaluating the reliability and quality of web-based information, the guide also defines a treatment summary and survivorship care plan. It provides information about common long-term and late effects and suggests ways to improve health and includes a short list of online resources. And then lastly, this work group developed a cancer survivor's prescription for finding information, and it resembles a prescription tear sheet and can be offered by the provider as an initial resource to cancer survivors. The prescription is a communication mechanism for providers to refer patients to local and national resources and opens the door to discuss survivorship. Both this guide and the prescription are available for free on the website at the bottom of the screen, and they're also free to order in bulk if you'd like to do that. The purpose of the program and navigation work group was to build consensus around the programmatic and navigation needs of survivors in order to improve quality of life and reduce barriers to receiving care. Work group members assessed the evidence base for programs addressing the multidimensional needs of cancer survivors and identified performance indicators to measure the impact of these programs on quality of life. They also recommended tools and resources to assist navigators as they addressed survivors' needs during the post-treatment transition period. So the gaps identified by this work group were the need to create a consensus-based definition of a cancer survivorship program, and then a need to increase evidence-based survivorship programs. The group recommended that a definition of a cancer survivorship program be developed in order to establish a standard for survivorship care. The definition here is as comprehensive as possible in that it includes key elements of care that are both psychosocial and medical with an emphasis on multidisciplinary care provision. So I'll take a minute and just let you guys read through this. In an effort to fill the gap in the lack of evidence on the effectiveness of survivorship programs, we have developed a guide called Moving Beyond Patient Satisfaction, Tips to Measure Program Impact. This is a brief guide that highlights basic evaluation steps, and it's designed to assist program directors and program managers when evaluating survivorship programs by recommending evidence-based measurement tools to show the program's impact on survivorship. And while the guide does cover the basics of program evaluation, such as participant satisfaction and program attrition, etc., there is a more apparent focus on various core outcomes and measurement tools that could be applied across survivorship programs. Again, this is also available on our website. To address the second gap regarding limited information on the availability of resources for post-treatment survivors, we have developed the Cancer Survivor Program Resource Inventory. This is not to be confused with the Survivor Information Resource Inventory that I mentioned earlier. This is kind of a part two to the gap analysis that we're doing, but this is more resource-oriented, whereas the other inventory is more information-oriented. So this is a mechanism, again, to identify gaps in survivorship programming and then to catalog cancer survivorship activities provided by community cancer centers, academic medical centers, clinics, etc. So we plan to compile the list of programs and support services into an online searchable repository using the American Cancer Society's website, cancer.org. And by doing this, we actually hope to increase the awareness of survivorship activities from various care delivery settings and in various geographic locations, which in turn will help drive survivors and caregivers to the programs. And we are currently collecting information from Commission on Cancer accredited facilities nationwide. Data collection has closed for both East Coast and Midwest regions, and the West Coast will wrap up in mid-July. So in terms of Iowa, you guys have had a great response rate. You've had a little over 50%, and I noticed some of you are on the phone, or some of you were signed up to attend this call today. So Michelle Johnson, Joan Feltner, and Kathleen Ollinger. I appreciate your completing the resources from your COC accredited facility. The next is the Chronic Disease Self-Management Program. It's entitled Cancer, Thriving, and Surviving. And right now we're in the pilot phase of this. It's actually a 6-week random controlled trial. It's an asynchronous online workshop for post-treatment survivors of non-pediatric cancers. There's a small incentive of a $10 Amazon.com gift card available with the completion of each survey, and there are 3 surveys total. The groups are actually composed of around 20 to 25 survivors, and these are the groups that participate in each workshop. Currently, we have about 88% women, 45% breast cancer survivors. However, there's also a large range of other cancer types represented. And some participants, they've completed treatment last week or, within the past 15 years, but I would say the majority of them are in completion of treatment within the past year and a half. They're actually expected to log on to at least 2 times a week to the website for a total of 2 to 3 hours a week. And the workshops are facilitated by 2 trained peer survivors, with each facilitation team consisting of 1 ACS volunteer, 1 experienced facilitator with the National Council on Aging, which actually owns the delivery platform for this program. Our original enrollment goal was 600, and we actually met that in early May, so we increased the enrollment to 900 participants enrolled by this coming September. So we would have a total of 15 workshops, followed by workshops for our control group after 1 year follow-up. And recruitment has occurred in a variety of settings. First, we went through direct ACS channels, such as the Cancer Survivors Network, the Survivorship Center's website, and then we went through social media, so mainly Facebook and Twitter, and through ACS partners like the National Cancer Institute's Community Cancer Centers program. We monitor the success of these different recruitment channels on a weekly basis. And then we also have a satisfaction survey available at the end of each workshop. These research questions were partially determined by the findings of previous studies, and we want to compare our outcomes with those studies. We will be analyzing the discussion board content for themes in order to supplement our quantitative data. We are looking also at usage analytics of the workshops just to see if there are trends in user drop-off and to see how the participants are reading the content versus using the discussion boards. I think this might be a good place for a pause if anyone has questions.
While we're giving them a chance to type, I had a question, or 2 questions. Mrs. Sarah, you mentioned that they could order the prescription tear-off sheet or the survival guide in bulk. Is that on your website, or where do they do that?
I believe so, but if you guys want to jot down this email address, Patrice Bowles is our project coordinator, and she handles all of these orders. And the email address is actually on the website, but I will tell you again here. It's survivorship@cancer.org, O-R-G.
Survivorship at cancer. Okay.
Yes, at cancer.org.
And then I had another question. The program you were just talking about, is it all web-based? So do they have to log on when the speakers are, or the facilitators are there, or you said it's something that they watch later? Like how on time is it, I guess? Do they have to be there a certain time, or can they log on anytime?
They can log on anytime.
Okay.
Anytime, yes. And I see that Dick Beck had a question: how does a survivor become a participant in the Thriving and Surviving program? Again, this can be found on the Survivorship Center's website, but I can email you guys or email Sarah, and she can forward on the information for a direct link instead of having to go down click down to the various areas. But yeah, I can email that to you, Sarah, if you want to send it to the group, because I don't have access to the whole consortium's the contact information for all your consortium members.
That would work great. Does anyone else have any? questions. I don't see anyone else is typing, so I think you can.
All right.
Feel free.
Sure. So a third group called Systems, Policy, and Practice Clinical Survivorship Care identified gaps and made recommendations as they relate to impacting healthcare system level of the socio-ecological model. And the goal of this effort was to improve primary care providers' knowledge of issues faced by cancer survivors. A key recommendation from this work group, and really a consistent message across all of the work groups, was to systematically develop evidence-based clinical practice guidelines to address both the medical and psychosocial needs of post-treatment cancer survivors. So the purpose of this work group was to support the creation of recommendations for clinical survivorship care guidelines and identify opportunities to enhance healthcare provider understanding of post-treatment survivorship issues. The end goal being a raised awareness of the issues that cancer survivors face, increased confidence on the part of healthcare providers in caring for cancer survivors, and then providing training. This is also consistent with the Institute of Medicine's recommendation regarding the development of such guidelines. Our target audience consists of primary care providers, including general practitioners, geriatricians, gynecologists, physician's assistants, nurse practitioners, and nurses. And as a cancer survivor transitions from active treatment in their oncologist care to recovery in their PCP's care, the PCP likely does not have a standard of care to guide them in dealing with post-treatment issues. So the guidelines will provide clinical care standards to address assessment and treatment of physical and psychosocial long-term and late effects, cancer screening and surveillance, and then health promotion. The guidelines, coupled with the treatment summary and survivorship care plan, will better facilitate the transition of cancer survivor from oncology care and return to their PCP by providing tools that communicate the care they already received from their oncologist, how their care should look moving forward, and how to manage their care according to evidence and clinical practice-based guidelines. So 10 primary cancer sites have been prioritized for guidelines, and we are currently working on draft guidelines for breast, prostate, colorectal, and head and neck cancers. This slide illustrates our guidelines process put into place following the revision of the ACS process for creating trustworthy cancer screening guidelines. In December of 2011, these changes were put into effect to ensure that ACS's process was in alignment with that of the Institute of Medicine's new standards for how guidelines should be developed. Prior to convening the expert panel work group to provide an overview of the process and deliverables, ACS project staff conducts a preliminary literature search to launch the process and to provide some basic information for the work group members. Topic buckets are generated from the preliminary search and used to allow the work group members to self-select into their specific topic bucket. Once work group members have convened and selected a topic bucket, they proceed with additional literature review and synthesis. And then this synthesis is combined with the expertise in practice and is used to develop the draft guidelines based on that topic bucket. Each member submits their drafts to the staff lead to be compiled into a comprehensive draft guideline for the cancer site. The draft guidelines are then shared with the work group and discussed via a conference call to draft the final guidelines that will be reviewed by the American Cancer Society's Mission Outcomes Committee, our Chief Medical Officer, and then on to the National Board of Directors. The entire process takes about 9 to 12 months, and it results in published guidelines manuscript in CA, a journal for clinicians. So as published last July 2012 in CA, the general guidelines for follow-up care for cancer survivors are as follows. Request a treatment summary and survivorship care plan from the patient's oncology team. Routinely counsel patients on health promotion issues and follow the American Cancer Society nutrition and physical activity guidelines for cancer survivors. Follow American Cancer Society cancer screening guidelines to screen for second primary cancers. Know and recognize the signs and symptoms of cancer recurrence and refer patients to appropriate follow-up tests or to oncology provider for follow-up. Routinely assess psychosocial status of patients and refer to psychosocial services or prescribe medication as needed. Next, let's turn to the provider education and program resources. Also contributing to the healthcare system level change that has been our work on provider education. While the work of developing survivorship care guidelines continues, we are working to improve the knowledge and skills, particularly of primary care providers around cancer survivorship. Launched on April 15th of 2013, the Cancer Survivorship e-learning series is a free continuing education program that provides a forum to educate primary care providers who may have patients who are cancer survivors about how to better understand and care for survivors in the primary care setting. Continuing education credits are available at no cost to participants for each one-hour module. The objectives of the Cancer Survivorship e-learning series for primary care providers are first, to increase PCP awareness of ongoing needs of cancer survivors. Secondly, to increase PCP knowledge of how to care for cancer survivors. And then thirdly, increase PCP ability to provide follow-up care for cancer survivors. And right now we actually have 3 modules that are currently up. We will be working on more and adding more later this year. So the first module that we have is, the title of it is The Current State of Survivorship Care and the Role of Primary Care Providers. The module 2, the title of that is Late Effects of Cancer and Its Treatments, Managing Comorbidities and Coordinating with Specialty Providers. Module 3 is Late Effects of Cancer and Its Treatment, Meeting the Psychosocial Healthcare Needs of Survivors. So as of May, we have more than 1,050 people have visited the website since it launched on April 15th, representing 31 countries, so we're excited about that. And the way to access this is, the actual website for this is Cancer Survivorship Center Education.org. Again, Sarah, if you want to, I can type that here.
But you was Cancer Survivorship.
I'm actually typing it now. Let's see, center. There you go. Cancer Survivorship Center Education.org. Yep, that's it. So I also have a brochure that kind of describes this in more detail. Sarah, I will send that to you after the call. That way you can distribute it to your group. It'd be great for something for you guys to print out and put around in your facilities, just to create awareness that this exists. Right. So with the initial launch of the e-learning series and with 3 guidelines nearly finalized, the GW Cancer Institute will it'll conduct focus groups to determine how guidelines impact practice change, how providers prefer to receive guidelines, guideline use in practice, guideline format preference, and then optimal methods for educating primary care providers on survivorship guidelines and related survivorship care delivery information. The results of the focus group will help us refine future guidelines and education modules and may inform the development of materials to support the implementation of clinical care guidance among PCPs in the years ahead. The guide for delivering survivorship care is currently being developed and finalized by Survivorship Center staff at GWCI. The purpose of the guide is to provide information on how to deliver quality survivorship care, including the standard of survivorship care, survivorship program overview and program models, survivorship program development, and tools and resources for healthcare professionals. This actually evolved out of GWCI's executive training on navigation and survivorship's guide for program development, which walks healthcare professionals through the process of developing, implementing, evaluating, and sustaining navigation and survivorship programs. The Survivorship Center Guide for delivering survivorship care, though limited to survivorship, expands upon the executive training guide to include what makes up quality survivorship care and how to deliver it. This will be available online on our website again this summer. So now onto our last portion, which focuses on the society policy level of the model. National policy change has the ability to affect the greatest number of cancer survivors. And as the population of cancer survivors increases to more than 13 million in the U.S., the need for policy change continues to increase as well. So what did the policy advocacy work group members find in year one? Based on an extensive review of the literature and discussions among the work group members, these 4 gaps were identified as having the highest priority. Gaps in financial reimbursement of clinical survivorship services, gaps in research, funding, and limited evidence base on which to base policy recommendations, need to establish which operational or organizational structure is most effective and efficient in delivering survivorship care, and then lastly, lack of information on the costs and benefits of providing clinical survivorship care. Recommendations made to fill these gaps were primarily centered around reimbursement, research funding, and then education. The health policy paper titled Cancer Survivorship, a Landscape Analysis derives from the work of the Policy Advocacy Work Group. And the paper provides a broad overview of the issues impacting survivorship. It covers topics such as the challenges in delivering survivorship care, the limited evidence base of late and long-term treatment effects, and the difficulty in financing survivorship care. A PDF is available here at our website. And then the second policy paper is themed around establishing survivorship as a public health priority, where survivorship is discussed within the context of chronic disease. This is also something that our funder, the CDC, is extremely interested in, and so we're working on a manuscript that will be published later this year. So to summarize, this is what we've done to date, and a little bit on our next steps. We've developed clinical follow-up care guidelines for the most prevalent cancer sites and those with more severe long-term and late effects. These guidelines will be aimed at the primary care provider to help facilitate the provision of patient-centered care and encourage the communication between primary care provider and the oncology team. We've developed provider tools to facilitate clinical follow-up. These tools may include communications materials to help providers discuss long-term late effects with their patients, as well as technology tools such as EMR prompts or smartphone applications. We hope that these tools will help increase the dissemination and utilization of the guidelines by a variety of primary care providers. We plan to develop and deliver provider education via multiple channels and across multiple disciplines. In addition to delivering educational webinars, the Survivorship Center is exploring ways to integrate survivorship content into medical education and training. The Survivorship Center also intends to utilize professional publications and conferences as an avenue to disseminate information to providers. We also plan to develop patient education and resources to address gaps. A key component of patient-centered care is ensuring that the patient is well-informed and capable of having a two-way discussion with their provider. The Survivorship Center's educational materials will help empower patients to manage their survivorship journey and encourage a provider-patient relationship. We plan to evaluate the dissemination, utilization, and impact of clinical follow-up care guidelines on survivorship outcomes. And we also plan to shape systems and policy changes to enhance survivorship care and improve survivorship outcomes. To be successful in improving the quality of life of cancer survivors, it's necessary that policies support the reimbursement of care and increase funding dedicated to the surveillance and research of survivorship. So the American Cancer Society and George Washington Cancer Institute staff have disseminated resources and presented information on the Survivorship Center to these key stakeholders here listed on the slide. Synergistic with the goals of the Survivorship Center, but not funded by the center, GWCI continues to provide its executive training on navigation and survivorship, finding your patient focus. The program is a 2-day in-person training preceded by a pre-course webinar that equips decision makers program leaders with the tools needed to launch and sustain navigation and survivorship programs, two cornerstones of patient-centered care. More than 180 individuals have learned strategic planning techniques for developing, implementing, evaluating, and sustaining patient navigation and survivorship programs. In 2013, through separate funding, the George Washington Cancer Institute will also start to address 3 of the 4 societal level gaps identified by the Policy Advocacy Workgroup. The gaps again here are, first, gaps in research funding and limited evidence base on which to base policy recommendations. Secondly, need to establish which operational or organizational structure is most effective and efficient in delivering survivorship care. And then third, lack of information on the costs and benefits of providing clinical survivorship care. Through a $2.1 million award from the Patient-Centered Outcomes Research Institute, some of you guys know this as PCORI, the GW Cancer Institute, in collaboration with the American College of Surgeons Commission on Cancer, the Cancer Support Community, Livestrong, and the American Cancer Society will be able to contribute to the evidence base for policy recommendations and identify which models are most effective in delivering outcomes important to patients. The primary goal of this 3-year study is to evaluate the effectiveness different models of care have on patient-centered outcomes for cancer survivors. The team will accomplish this through the development of a patient-prioritized framework, an instrument to assess high-quality survivorship care, drawing from the Cancer Support Community's national system of support to garner diverse patient input on what quality survivorship care looks like. The research team will also create a program implementation index to define survivorship models of care using the Livestrong essential elements of survivorship care, and they will identify high-performing programs among those institutions accredited by the American College of Surgeons Commission on Cancer. Finally, 3 survivorship care models will be compared to evaluate their effectiveness of impacting patient-prioritized outcomes. With that, I'd like to acknowledge my colleagues, hard workers. This is our team on the Survivorship Center Cooperative Agreement. Of course, you may contact any of us. All of our emails are here. This is all open door. And then you've seen this a couple of times, the Survivorship Center webpage on cancer.org, and then our email address, which Rachel Schramm, thank you so much for typing that into the chat box. And I know we have a little over 20 minutes. If anyone has questions.
While they're typing, I'm just going to open up another screen with our evaluation for today, so people may see that pop up.
Okay. And of course, I think, Sarah, since this has been recorded, I think if any of your colleagues missed this, you can always forward them the link to the presentation. I think the slides will also be available. Sarah, is that right?
Yes, we'll have the slides separately if someone wanted to flip through them. Otherwise, we'll have the recording of the whole webinar. And I was just writing a whole list of people I think should get a copy, but I think it was great. You covered a lot of information I was unaware of, and I think there's lots of groups in Iowa that would benefit from the information. So if anyone is on the phone and you want to ask a question, you need to make sure you unmute yourself, and that's *# again. And then if anyone has a question, you can go ahead and type it in the chat box. Not seeing anyone typing.
Doesn't look like it. Some of you guys may be in the middle of eating lunch and trying to, yeah.
Well, I think
Again, I mean, if you guys do think of questions, if anybody has any questions, you can always send them to survivorship@cancer.org or to me, Rachel, R-A-C-H-E-L. I will put this in the box, rachel.kennedy, cancer.
I think you did a great job covering everything, and the slides are will be definitely distributed. So There was one other thing you were going to send to me. The brochure that people could print out and put up about the PCP
Yes, the
training. Yep.
Okay, yes. I will send that to you when we hang up.
And if everyone could complete the SurveyMonkey, the questionnaire that should have popped up, I will also forward that when I get the link to the recording and the slides. I'll send all that out at one time to everyone who was able to attend, and then even those who weren't able to be on today. So I think that's it. I don't think anybody has any questions, but I'm really appreciative. I think it was a great presentation. I thank you for your time, Rachel.
Thank you. It was a pleasure to present the work that we're doing. I know it's a lot to digest, but again, if you guys have questions, feel free to reach out to me, and I will send you 3 different things. I'll send you, well, the Survivorship Center